Hi, my name is Kayla Keeney, and this is my Grand Rounds project for Nursing 665. Patient demographics. So the patient is an 18-year-old male. Medical history is he has asthma, which is controlled with an albuterol inhaler. He denies any surgical history. Family history, his mother is alive at the age of 40, but has type 2 diabetes and asthma. Father is alive at the age of 40 with no medical history. Maternal grandmother's deceased, cause of death is COVID-19. Maternal grandfather deceased, cause of death is a heart attack. Paternal grandmother is alive at the age of 60, but has type 2 diabetes, asthma, COPD, and Parkinson's. Paternal grandfather is alive at the age of 62, but also has Parkinson's and heart failure. Patient is an only child. Social history, the patient is in a relationship with his girlfriend for the past year. He exercises 3 to 4 times a week at the gym, currently not participating in sports. Occupation, he is looking for a job. Highest education, he just recently graduated from high school, not planning for college in the fall. Smoking, he reports smoking marijuana 1 to 2 times a day. He denies any drinking and denies any drug use. Sexual history, he likes pronouns are he, his, him, hims. He's sexually active with his girlfriend. They're using condoms. No children and no past medical history of an STI. Chief complaint, the patient reports that his body feels weak and fatigued, and my throat is burning over the past 4 days. The onset, the patient reports weakness, fatigue, and sore throat with a recent temperature of 102 for 4 days. The location, the patient reports the pain in his throat and feeling weak and fatigued throughout his body. Duration, patient reports pain is constantly throughout the day. Aggravating factors. Patient reports aggravating factors when trying to swallow food and talking. And relieving factors is also using fluids and cough drops. The timing, the patient reports it is worse in the morning, and severity, the patient reports 8 out of 10 on a pain scale of 0 to 10. So for this, constitutional, patient reports weakness, fatigue, fever, denies changes in weight, denies shortness of breath, denies difficulty breathing, denies anxiety, denies depression, reports a sore throat, pain, and difficulty swallowing. He denies any changes to his scalp, denies head trauma, lesions, and masses, denies eye pain and discomfort, denies changes in vision, denies nasal congestion, denies changes in hearing, denies bleeding gums and ulcers, denies chewing, difficulty chewing. He denies chest pain, denies discomfort, denies palpitations, denies edema, denies orthopenia. He denies nausea, vomiting, diarrhea, jaundice, tenderness, and bloating. He also denies pain, urgency, frequency, discharge, hematuria, and nocturia. Patient does report weakness and fatigue throughout his body, denies pain, denies gout, denies arthritis, denies redness, denies swelling. Metabolic, he reports changes in his appetite relating to swallowing, denies excessive thirst, hunger, and urination, denies changes in weight, denies thyroid and diabetes issues. Physical examination. The patient is 6 foot 4 inches long, weighs 170 pounds. Current temperature is 99.2. Blood pressure is 108 over 70. Heart rate is 97. Respiratory rate is 18. Oxygen saturation is 96. And currently, pain is 8 out of 10 on the 0 to 10 pain scale. Again, he is an 18-year-old Caucasian male, appears appropriate for his age. Patient is alert and oriented to person, place, time, situation, and he's also cooperative. Patient can speak clearly and appropriately with mild distress due to throat pain. His head is normal cephalic. Hair is thick and distributed throughout the scalp. No scaling present. No lymphedema present. Sclera is clear. Conjunctiva is white. Extraocular movements is intact. Perla is intact. Acute acuity with whispered voice is good. Tympanic membrane is intact. No pain. No inflammation. No lesions. External air canal is intact, no lesions, no tenderness, no masses, no inflammations. Articles are symmetrical. No lesions, no inflammation. Auditory canals normal, no abnormalities. The eardrum tympanic membrane's gray and translucent. No pain, no redness, no inflammation. The nose has no pain, no tenderness, no discharge, no nasal congestion, no sinus pressure. Septums in midline, inferior and middle turbulence is normal. His mouth, his lips are intact, pink and dry. Good oral hygiene. No oral lesions. Tongue is red and intact with white patches noted. No open areas. His gum and mucosa has no pain, no swelling, no signs of infection on his gums. Um, for his throat and tonsils. They're intact, they're pain. There's redness noted with enlargement of the bilateral tonsils with white exudates on the tonsils. His neck is intact, no lumps, no goiter, no tracheal shift, no deviation. Neurological, the patient is alert and oriented times 4, speech is clear, cranial nerves are intact. The skin is warm and dry to touch, no open areas, no petechiae, no cyanosis, no clubbing. Lymph nodes are mobile, swollen cervical lymph nodes, no tenderness to axillary intercoccular inguinal endopathy. CV, normal S1 and S2, no extra heart sounds, no murmurs, no gallops, no rubs, no thrills, no crepitus. +2, pulses on all extremities. JVP, normal, carotid upstrokes brisk, and then the PMI is midclavicular line of the fifth intercostal space. The peripheral vascular system, again, +2 symmetric pulses, no bruise in the femoral abdomen present. All extremities are warm, dry, and symmetric with no edema present. Calves are non-tender, no pain, no varices present, no stasis present. Respiratory rate is 18, no shortness of breath, no difficulty breathing, no cough, no cyanosis. Lung sounds are clear bilaterally, no abnormal breath sounds. Thoracic is symmetric with good expansion. GIGU, last bowel movement was this morning. Patient reports having 3 bowel movements a week. Abdomen is soft with bowel sounds present in all quadrants. No tenderness, no garden while palpating, no pain present. Reproductive, there's no lesions, no discharge, no redness, no pain. Muscular, good range of motion for hands, wrists, elbows, shoulders, spine. Hips, knees, and ankles, strength is 5 to 5. Upper and lower extremities, no pain, no deformities, no tenderness. Metabolic and endocrine reports tenderness to the neck related to throat pain, no mass to neck, no goiter present or enlargement. So differentials for this 18-year-old male is group A, streptococcal pharyngitis, so otherwise known as strep throat, infectious mononucleosis, which is mono, which is caused by EBV, COVID-19, and periodontal abscess. So this is group A, streptococcal pharyngitis, which is basically strep throat. It's caused by the group A, streptococcus. The patient would have like pain, fever, redness, difficulty swallowing. They report like the tongue being like a strawberry tongue, headache, decreased appetite, nausea, and vomiting. Currently, the patient is experiencing weakness, fatigue, fever, difficulty swallowing, decreased appetite, swollen cervical lymph nodes, white exudates, swollen tonsils, red tongue. Here is a picture from OSF Healthcare in 2025. It shows the patient's experienced throat pain, redness, white patches, and large lymph nodes on the neck. So it just gives you a nice visual of this. Um, Infectious mononucleosis, EPV, also called mono. It's caused by the Epstein-Barr virus. Again, the patient, if they had this condition, would have fever, swollen tonsils, difficulty swallowing, headache, decreased appetite, weakness, a spleen rupture, fatigue. Here is a diagram of a patient and what they would look like. Again, the patient is experiencing weakness, fatigue, fever, difficulty swallowing, decreased appetite, swollen tonsils, swollen cervical lymph nodes, and a red tongue. Another diagnosis, which is a newer condition that we have dealt with within the past couple years, is COVID-19, which is caused by the SARS-CoV-2 virus. And this is contagious and can happen at any age. They can have shortness of breath, dry cough, nausea, vomiting, decreased appetite, a rash, a red tongue, chills, weakness, fatigue, loss of smell, loss of taste, sore throat. And this is just like another diagram. Periodontal abscess. So this is like an emergency situation. So basically pus forms behind the tonsils and can cause difficulty breathing and can cause them to aspirate. Um, for this, it shows in this diagram what a normal tonsil would look like, and then on the bottom shows what an abscess. So you could see like it's starting to become more closer to their airway. So they would have changes in their voice, fever, unilateral sore throat, difficulty swallowing, uvula deviation, ear pain, and jaw pain. So for this patient, diagnosing him with group A streptococcal pharyngitis, otherwise known as strep throat. So for this, you would do a rapid throat test and culture. So in the office, you could test it, be like, okay, they have strep, and you can also send it out. Pharmacological treatments, there's different treatments you could do depending on if the patient has any allergies. So amoxicillin 500 milligrams twice a day for 10 days by mouth, or azithromycin 5 milligrams by mouth for the first day, then 250 milligrams for 4 days. So again, that is a total for 5 days. Or cephaloxin 500 milligrams 4 times a day for 10 days, especially if they have a penicillin allergy. Side effects, the patient can experience diarrhea, vomiting, rash, abdomen pain. It's important to seek medical attention, especially if they have like shortness of breath, rash, hives, wheezing, as those are signs of an allergic reaction. And the biggest thing is to make sure that the patient does not have mono. So you can't just look at the patient and say, oh, they have strep throat. You have to do a culture and a throat test to make sure that they do not have mono because they can get an amoxicillin rash if you start them on amoxicillin. And then also, it's important for pain management. You could do acetaminophen or ibuprofen as needed for pain. Non-pharmacological treatment for the patient is resting, staying hydrated, avoiding smoking marijuana. It is noted that this patient smokes 1 to 2 times a day. Use warm salt water rinses, lozenges, humidifiers. Eat soft food so it doesn't like irritate the throat. Use honey, which can help soothe it, and avoid other irritants. So like if you're spraying like perfume, or again using marijuana, it's just going to irritate the throat. At this time, referrals are not needed for the patient, but if it still does not get treated with the antibiotics, they can reach out to ENT or infectious disease. Patient education, it's important to take the medications as directed, even if feeling better. It's important to finish the antibiotic so it doesn't come back. Staying hydrated, avoiding irritants, using the saltwater rinses, using lozenges, um, hand hygiene, avoid smoking marijuana, avoid sharing items, and stay home until the antibiotics and symptoms start improving and that he's not having fevers. Um, Follow up if the patient still is not feeling the greatest and the symptoms aren't improving or they're worsening, he should see medical attention from the provider. So, what if the patient was very young or old? How would this change care? So, again, if the patient was young, they may appear fussy, difficulty with feeding, fever. It's not common for them to usually have strep unless they're exposed to like a sibling or somebody. So they wouldn't do testing for strep. They can have like other conditions such as like an ear infection or dehydration. But again, it's important to remember like pediatric patients, they are weight based. So it's important to have an accurate weight on them. On the other hand, if the patient was very old, the medication would remain the same, but it's important to know that these patients have comorbidities. So, like they could have hypertension, diabetes, and it's important that the medications that we're prescribing is not going to interact with the current medication regimen that they are on, and they can be at a higher risk for side effects, such as like confusion or like changes in their bowel and bladder. Another differential that can be considered is influenza, which is, again, it is caused by a virus. So the patient, again, we talked about this 18-year-old who's experiencing weakness, fatigue, fever, difficulty swallowing, decreased appetite, swollen lymph nodes, white exudates, swollen tonsils, and red tongue, which can also be signs of influenza. So for this one, you would do a rapid flu swab to see if the patient has the flu. They can either have flu A or flu B, and depending on their symptoms, they can start on an antiviral such as Tamiflu. But depending on if they're out of that window, um, or they don't want to take the medication, supportive care, which is similar to strep. So staying hydrated, resting, encouraging fluids, pain management of Tylenol and Motrin would be the same for these patients as well. So what could have been done differently in a patient with limited resources or access to care? So basically, you want to do hand hygiene, encouraging fluids, using saltwater rinses, using lozenges, using honey, and avoiding irritants. But the biggest thing with having strep is to get treated, because it can cause other concerns. Um, what could change if a language barrier was present? So if this was present, it would be important to find out the native language of the patient. From there, you can use a medical interpreter as well as give them written information in the patient's native language. And when talking and using the interpreter, the provider can ask the patient to have the patient teach back, and see if they have any questions, just to make sure that the information's getting across. Also, if they have any other family members that want to be at the bedside, they can also be there as well, and they can review the information, which also relates to their culture. So, what could change if the patient had a different culture? So, it's important to be respectful of the patient's culture, as many beliefs reflect how they have their medical care. It's critical to ask the patient if they want other members, such as a significant other or parents or uh, brothers, siblings, to be involved in their care and listen, or if they want them to step out of the room. If the patient wants to incorporate their beliefs in their care, the provider should try to, if it is safe. Um, but it's important to build that therapeutic relationship for the patient and the family and the provider and the other members of the healthcare team, and really empower patients and to be proactive of their care, especially if they have a different culture or a different language or issues with access to care. And these are my references. And I appreciate everybody for listening to my PowerPoint, and I hope that you learned something. Thank you so much.